Hello, everyone. I'm Alan Weil, Editor-in-Chief of Health Affairs. Thank you for joining us today for this briefing on the 2021 health spending report. For those of you who've been with us before, you know that this is a much anticipated annual report coming out of the Centers for Medicare and Medicaid Services, Office of the Actuary. They have a team that does really the gold standard reporting for the country, both looking historically at patterns and trends in spending, as well as projections, which are released on a different schedule. We at Health Affairs have been proud and pleased to partner with the NHE team for quite some time, and to be able to host an event for reporters to get an early look at the data and to ask the questions that you may have. I'll probably say this 5 times, so here goes number 1. The results here are under embargo until 4 p.m. Eastern. That's 4 p.m. Eastern today. So this is a discovery period, but no release until 4 o'clock. Before I turn it over to the CMS team, Stu Ducat, our media director, is our point of contact for everything to do with this piece, and has a few words, and then we'll get into the substance.
Thank you, Alan. Just to let everyone know, as Alan said, the report is embargoed till 4 o'clock today. If you haven't received an advance copy of the study and would like one, please send me an email at sducat@projecthope.org. That's sducat@projecthope.org. Thank you.
And please avail yourself of whatever resources we can provide. We know this is important information. We want it to come out timely and in as clear a form as possible. It's very complicated material. But let's now move into the briefing. There are 4 authors named authors on the piece, and they are here. 2 of them will present, and 2 are here as resources. There may be others if you get really into the weeds, but you'll hear from Ann Martin, an economist in the National Health Statistics Group in the Office of the Actuary, Micah Hartman, a statistician in the same group. Joseph Benton is an economist within the Office of the Actuary, and Aaron Catlin is Deputy Director in the National Health Statistics Group in the Office of the Actuary. And of course, there is another team behind them, as well, of course, there's a team at Health Affairs that helps get this published. Again, under embargo until 4 o'clock Eastern. That's my second shot at this, and we'll have the presentation. Ann Martin will lead us off, and after the presentation, we'll have an opportunity. I'll field questions from those of you in the audience. Ann, over to you.
Thank you, Alan, and thank you, Sue. Hello, everyone. Thanks for joining us today. My name is Ann Martin. I'm one of the authors of the 2021 National Health Spending Report. I'm joined by my co-authors, Micah Hartman, Joe Benson, and Aaron Catlin, as well as the other members of the National Health Expenditure Accounts team. Today's presentation is going to focus on the results of our analysis of healthcare spending for 2021. And I'll remind everyone again that all data presented here, as well as any discussion surrounding these findings, is under embargo until 4 p.m. today. When the embargo is lifted, the data will be available on the CMS website, and the article will be published in a web-first edition of Health Affairs. In January of 2023, the article will appear in the print version of the journal Health Affairs. So I'm going to start by going over a few of the main points from the 2021 analysis. Total healthcare spending reached $4.3 trillion, or $12,914 per person. This was up 2.7% from the previous year's health spending total, but the rate of growth was much slower compared to the 10.3% increase in 2020. Next, the share of the economy devoted to healthcare was 18.3% in 2021. This was a smaller share than in 2020 when it was 19.7%, but still higher than the 17.6% share in 2019. The primary reason for these trends is the impact of supplemental COVID-19 funding. Federal government spending declined 3.5% in 2021, following record high growth of 36.8% in 2020. Federal government spending includes spending for the Provider Relief Fund, Paycheck Protection Program loans, and federal public health activity. Federal public health includes the funding for vaccine development, stockpiles of drugs and vaccines, and health facility preparedness. The Provider Relief Fund and Paycheck Protection Program loans provided financial assistance to providers during the public health emergency. These sources continue to provide funding in 2021, but at much lower levels than in 2020. When the supplemental COVID-19 funding is removed from NHE, the trend is 2.3% growth in 2020 to 7.6% growth in 2021. And this trend generally reflects an increase in utilization in 2021. And finally, we show that the number of uninsured individuals fell by 2.7 million in 2021 due to increased enrollment in Medicaid and Marketplace, which outweighed a reduction in employer-sponsored health insurance enrollment. On this slide, we are showing the growth rates of national health spending compared to growth in gross domestic product or overall economic growth. We also show the growth in national health spending with and without spending from other federal programs and federal public health, the two spending categories that contain the majority of the COVID-19 relief funding. The red line shows the growth in total healthcare expenditures, which slowed from 10.3% in 2020 to 2.7% growth in 2021. The green line represents the growth rate without the COVID-19 relief funding. As mentioned previously, this growth was 2.3% in 2020 and accelerated to 7.6% in 2021 and represents primarily increased use of healthcare goods and services in 2021. Then looking at the blue line, which is GDP growth, we see how the economy increased at a fast pace of 10.7% in 2021 after declining in 2020, which was due partially to a short economic recession in March and April at the start of the pandemic. Because of these divergent trends in health spending and GDP, the share of the overall economy devoted to health, which is the purple line, jumped in 2020 to 19.7% from 17.6% in 2019, and then fell to 18.3% in 2021. This chart shows the distribution and growth of spending by sponsor, or the businesses, households, and governments that are responsible for financing healthcare payments. The chart on the left shows the distribution of each sponsor to total healthcare spending. The federal government makes up the largest share at 34.2%. This is down slightly from its record high share of 36.4% in 2020, but still higher than its share of 29.4% in 2019. Households make up the second largest share at 26.9%, followed by private businesses, state and local governments, and other private revenues. The chart on the right shows the annual growth rates by sponsor. Due to COVID-19 relief funding, federal government spending spiked in 2020, increasing 36.8%. In 2021, the spending declined by 3.5%, but the levels were still higher than in 2019. In 2021, spending by the other sponsors of healthcare all grew faster following declines or slow growth in 2020. For state and local governments particularly, the growth in 2021 was due primarily to Medicaid bouncing back from the drop in 2020 that was due to the increased federal medical assistance percentage associated with the continuous enrollment requirement of the Families First Coronavirus Response Act. This graph breaks down the spending growth for total national health expenditures and identifies the components that had both positive and negative impacts on the overall growth rate for 2019 through 2021. In 2021, while overall spending increased at a lower rate, it was due to a mixture of positive and negative impacts. Positive spending growth was seen in the health insurance categories indicated in red, which includes payers such as private health insurance, Medicare, and Medicaid. Negative impacts were experienced for other federal programs as indicated in green, and public health activity as indicated in purple, which both declined in 2021 after experiencing faster growth in 2020. These two categories include the majority of COVID-19 supplemental funding that provided financial assistance to providers during the public health emergency. So this slide breaks down the categories that contain the COVID-19 relief funding into greater detail. As shown on the previous slide, the category total other federal programs experienced a decline in spending in 2021 after higher growth in 2020. From this chart, we can see that in 2020, total other federal program spending jumped from $14 billion in 2019 to $193 billion. Then in 2021, spending came down to $72 billion, a 62.7% decline, but the level was still much higher than in 2019 and prior years. Among the detailed spending categories, we can see that a large part of the combined funding from Paycheck Protection Program loans and the Provider Relief Fund went to hospitals and physician and clinical services. And in 2020, a large portion also went to nursing homes. Similarly, we can see the large decrease in spending for federal public health in 2021 from a level of $136 billion in 2020 to $79 billion in 2021, a decrease of 41.9%. Moving on to other breakouts of national health spending, aside from spending by sponsor, this slide takes a look at an aggregate view of some of the high-level categories before we go into more details by type of payer and by type of service. On this chart, we show the shares and growth rates for personal health care and all the components of non-personal health care. Personal health care is the sum of all medical goods and services and accounts for 84% of total health spending. Although utilization of goods and services increased in 2021, other federal program spending is included within the service categories, and as shown on the previous chart, spending declined for this category in 2021, bringing personal health care growth to 5.5%, which is slightly slower than the 6.1% growth in 2020. Therefore, from this perspective, we can see that the slower growth in national health spending is not entirely driven by the slower growth in personal health care spending, but is also being influenced by some of the categories of non-personal healthcare spending, which includes government administration, the net cost of health insurance, public health, and investment in research and structures and equipment. In particular, the categories of the net cost of insurance and public health activity declined in 2021 after large rates of increase in 2020. The net cost of insurance includes administrative costs for insurers, as well as taxes, fees, and underwriting gains or losses. The decline in 2021 is primarily due to coming off of a unique experience in 2020, when insurance companies set premiums in advance of the year, but benefit spending was lower than anticipated due to the pandemic. It was also partially due to the elimination of the health insurance tax, which affected private health insurance and the managed care portions of Medicare and Medicaid. And as shown on the previous slide, public health activity spending declined in 2021 because of the federal portion, which contains expenditures for COVID-19 related activities. Now to take a look at spending broken out by type of payer. On this chart, the categories include health insurance, which includes the payers in the pie chart on the right, such as Medicare, Medicaid, and private health insurance. It also specifies that out-of-pocket accounts for 10% of total spending, and other third-party payers and program, which also accounts for 10% of total spending, and includes all the payers as indicated in the footnote, including the payer other federal programs. Payments covered by health insurance accounted for 71% of the total $4.3 trillion in health spending in 2021, with private health insurance being the largest portion at 28%. Although the private health insurance share was unchanged from 2020, it is still lower than its share in 2019, when it was 31%. The private health insurance share decreased in 2020 when there was a decline in use and spending due to the pandemic. Medicare and Medicaid shares have remained relatively steady at 21% and 17% respectively. Two other categories that have shown recent fluctuations in their share of total health spending include other third-party payers and programs and public health activity. Prior to 2020, other third-party payers and programs accounted for approximately 9% of total spending. In 2020, this share jumped to 12% as Paycheck Protection Loan and Provider Relief Fund spending became part of this category. In 2021, the share fell to 10% as there were declines in spending for these federal programs. Likewise, public health activity, in particular the federal portion, experienced a jump in 2020, leading to its share increasing from 3% in 2019 to 6% in 2020. And in 2021, its share came down to 4% as federal public health activity spending declined in 2021. To gain further insight into these recent shifts in spending by payer, we highlight their annual growth rates for 2019 through 2021. When looking at the payers, private health insurance, Medicare, out-of-pocket, and other health insurance, we can see that all of these payers experienced faster growth in health spending in 2021 compared to 2020. Medicaid's growth was relatively steady at 9.2% in 2021, but was still strong. Much of the growth experienced by these payers is attributable to an increase in use in 2021, as people started to resume healthcare that they may have delayed or gone without in 2020. Therefore, it is apparent from this look at the total national health expenditures trend that it's being heavily influenced by the trend for other third-party payers and programs, which, as previously discussed, contains a large portion of the federal COVID relief spending. This slide presents the latest trends in enrollment. In 2020 and 2021, there were increases in the insured share of the population, reaching 91.4% in 2021. This translates to about 3.3 million fewer uninsured individuals in 2021 compared to 2019, when there were 31.8 million uninsured. One of the largest increases in enrollment was in Medicaid, which increased by 8.5 million to 84.7 million in 2021. The Medicaid enrollment increases in both 2020 and 2021 are partially attributable to the continuous enrollment requirement of the Families First Coronavirus Response Act, which increased the federal medical assistance percentage for states who did not disenroll beneficiaries. Private health insurance enrollment increased by 600,000 in 2021. This was driven by marketplace enrollment, which increased by 1.4 million people to reach 11.8 million in 2021. The increases in marketplace, Medicaid, and Medicare enrollment outweighed the decline in employer-sponsored insurance in both 2020 and 2021, as the pandemic contributed to shifts in health insurance coverage for many during this period. I'd like to turn the presentation over to Micah Hartman, who will take a look at the trends in payers and services in more detail.
Okay, thank you, Ann. I'm going to focus the remaining portion of the presentation on the recent trends by the major payers and medical goods and services in the NHE. I'll begin with private health insurance, which remained the largest payer of healthcare in the United States at $1.2 trillion, or 28% of total healthcare spending. In 2021, private health insurance spending increased by 5.8%, which was a turnaround from the 1.1% drop in spending experienced in 2020. The turnaround in 2021 was due to a pickup in utilization of medical goods and services following delayed or foregone care in 2020, as well as an increase in enrollment in 2021. Enrollment in private health insurance increased by 0.3% in 2021, as gains in marketplace coverage outweighed a decline in employer-sponsored coverage. On a per enrollee basis, spending for private health insurance increased 5.5%, as the use of medical goods and services picked up in 2021, and spending for almost all types of medical goods and services drove the turnaround in growth. As private health insurance spending for personal health care increased 9.6% in 2021, the net cost of private health insurance, or the difference between total private health insurance spending and personal health care, declined. Medicare spending was 21% of total healthcare spending and reached $900.8 billion in 2021, which was an increase of 8.4%, faster than the 3.6% growth experienced in 2020. On a per enrollee basis, spending growth was faster at 6.6% in 2021 compared to 1.5% in 2020, as spending on medical goods and services picked up, driven by faster growth in physician and clinical services and hospital care. Enrollment in the Medicare program increased 1.7%, which was slower than the 2.1% increase in 2020. The net cost of insurance for the Medicare program declined in 2021 as spending on healthcare goods and services accelerated, following much lower growth in 2020. The Medicare program can be looked at in more detail, and we can present trends for traditional fee-for-service alongside Medicare private health plans. Fee-for-service accounted for the majority of total Medicare spending at 54%. Enrollment in fee-for-service continued to decline for the third year in a row at -3.8% growth in 2021. On a per enrollee basis, spending growth was 8% in 2021, a turnaround from the 2% decline in growth in 2020. Medicare private health plan spending accounted for 46% of total Medicare spending in 2021. And spending growth for private health plans and Medicare have been increasing at double-digit growth rates since 2017. Enrollment continued to show strong growth at 10% in 2021. And on a per enrollee basis, Medicare private health plans increased 3.7%, which was slower than the 5.6% growth in 2020. The Medicaid program accounted for 17% of total healthcare spending in 2021, or $734 billion. This was an increase of 9.2%, which was almost the same as the increase in 2020 at 9.3%. The strong growth was tied to enrollment, as well as a pickup in spending growth for medical goods and services. Medicaid enrollment continued to show strong growth and increased 11.2% in 2021 as states were incentivized to maintain enrollment during the year to help provide healthcare coverage during the COVID-19 pandemic. Per enrollee spending declined by 1.8% in 2021, following growth of 4.3% in 2020. The decline was due in part to increased enrollment growth for qualifying children and adults that often have lower per enrollee spending profiles compared to elderly or disabled enrollees. Medicaid spending on medical goods and services increased 9.7% due to a pickup in spending growth for hospital care, physician and clinical services, and dental services. The Medicaid program is funded by federal and state and local spending, and on this slide, we highlight those trends by government category. Federal Medicaid spending saw double-digit growth of 18.8% in 2020 and 11.4% growth in 2021 due to the 6.2 percentage point increase in the medical assistance percentage that was authorized under the Families First Coronavirus Response Act. The medical assistance percentage determines the amount that the federal government will contribute towards Medicaid spending. When this percentage is increased, the federal government takes on a higher share of the spending. State Medicaid spending declined by 7% in 2020, but increased 4.6% in 2021, due again to the impacts of the increase of the medical assistance percentage paid by the federal government. The federal share of Medicaid spending was at 70% in 2021, compared to 69% in 2020. This is higher than what it was in 2019 at 63%. Now that we have looked at the major payers of healthcare, we will shift the focus of our presentation to the major spending categories for medical goods and services in the United States. Of the $44.3 trillion that was spent on healthcare in 2021, hospital care, physician and clinical services, and retail prescription drugs accounted for the majority of the spending at 60%. These shares do not usually change substantially from year to year for these three major healthcare categories. The remaining 40% of spending went towards other types of medical goods and services, as well as government administration and the net cost of insurance, investment, and public health spending. So now we will take a look at some of these trends in more detail. Starting with hospital care, we see that hospital spending accounted for 31% of total healthcare spending and reached $1.3 trillion in 2021, which was an increase of 4.4% and a slower rate of growth compared to 2020 when hospital spending increased 6.2%. The slowdown was due to the decline in other federal spending in 2021 as COVID-19 supplemental funding declined. This spending is included in the green portion of the bar on this chart. Only partially offsetting this slower growth in hospital care was the turnaround in spending growth for health insurance, which is the blue portion of the bar, and includes private health insurance, Medicare, Medicaid, and other types of health insurance categories. And also partially offsetting the slower growth for hospital care was the faster growth in out-of-pocket spending, or the red portion of the bar. The faster growth in these payers was due in part to an increase in utilization of hospital care in 2021, as COVID-19 pandemic-related healthcare restrictions eased for elective and non-emergency care, and inpatient days and discharges increased. And now looking at physician and clinical services, we see that it accounted for 20% of total expenditures and grew 5.6%, reaching $864.6 billion in 2021, which was a slower rate of growth compared to 2020 when it increased 6.6%. Like the trends for hospital care, the slowdown in growth was due to other federal program spending. The federal COVID funding had a positive impact on 2020 growth and a negative impact on 2021 growth when the spending declined. And again, similar to the trends for hospital care, there were some offsetting factors to the overall slowdown in physician and clinical services due to the other major payers, Medicare, Medicaid, private health insurance, and out-of-pocket, where spending growth accelerated in 2021. Increased insurance coverage and greater utilization of services contributed to the acceleration in spending, with physician visits increasing in 2021. For retail prescription drugs, spending reached $378 billion in 2021, about 9% of total spending. It increased 7.8%, which is faster than the 2020 growth rate of 3.7%. Supplemental federal COVID funding did not impact retail prescription drug spending growth as it did for many other healthcare service categories. The acceleration in 2021 was due primarily to increased prescription drug use as doctor visits increased in 2021, resulting in an increase in new prescriptions dispensed. There was faster growth among the major payers, including Medicare, Medicaid, private health insurance, and out-of-pocket spending. Prescription drug prices declined for the fourth year in a row, which indicates that non-price measures like enrollment growth and utilization drove the pickup in 2021. Looking at some of the other main NHE service categories, we show the impact that COVID-related federal funding had on spending growth for 2019 through 2021 using a similar breakdown as we showed on the previous slides. In 2020, across all four of these service categories, other third-party payers and programs accelerated, while at the same time spending for out-of-pocket and health insurance slowed or declined, particularly for dental services. This was the impact of increased federal funding outweighing a drop in the use of services. In 2021, there was a turnaround to this trend as federal funding declined and there was a rebound in the utilization of services. Other third-party payers and programs had a negative impact on total growth, and health insurance, including Medicare, Medicaid, and private health insurance, and out-of-pocket also had a mostly positive impact on total growth. Federal COVID relief funding had a greater impact on growth for nursing care facilities and home health care than it did for other professionals or dental services, as nursing homes and home health care agencies received a large amount of supplemental funding in 2020. Then in 2021, the supplemental federal spending for nursing homes and home health care declined to a much lower level, bringing down the overall growth rate for both sectors, with nursing home spending declining in 2021. And so we'll just take a look at the final main points here on our last slide. The overall rate of increase for healthcare spending was 2.7%, which was much lower than the 10.3% growth in 2020. The slowdown was primarily due to a decline in federal spending in 2021 at minus 3.5%, following a substantial increase in spending in 2020 at 36.8% due to COVID-19 supplemental funding and public health spending. When federal public health and other federal programs spending are removed, the increase in total healthcare spending is 2.3% in 2020 and 7.6% in 2021. This trend is more reflective of the trend in utilization of healthcare services over these 2 years. Among goods and services, hospital care, physician and clinical services, and retail prescription drugs showed measures of increased utilization growth in 2021. However, the faster utilization was more than offset by a decline in other federal spending, which led to slower spending growth for hospital care and physician and clinical services. With no influence from the other federal spending, the increased utilization for retail prescription drugs wasn't offset, which led to the faster growth in spending for retail prescription drugs in 2021. Among payers, faster growth in spending from private health insurance and out-of-pocket and Medicare were due to increased utilization and per-person spending, while Medicaid spending remained steady with strong enrollment growth. And finally, the economy increased by 10.7% in 2021, while healthcare spending increased by 2.7%. This resulted in the share of the GDP devoted to healthcare to decline from 19.7% in 2020 to 18.3% in 2021. However, the 18.3% share in 2021 is higher than the 17.6% share in 2019 before the COVID-19 pandemic. We thank you for your attention, and we'd be happy to take any questions that you might have at this time.
Thank you, Ann and Micah, for presenting incredibly complex material in a very clear way. I really appreciate it. I know those attending do as well. My third reminder that this is still under embargo until 4 p.m. Eastern today. If you joined us late, please don't miss that element. I'm now prepared to open up to questions. I prefer, if possible, that folks use the hand-raising function. That's probably the easiest way I can get a queue going. And I will ask you to identify yourself as I call on you. I'm not seeing any, and I hope that's not a technical problem on my end. But I know there are always questions. Okay, Joyce Frieden.
Yeah, hi, can you hear me?
Yes, thank you.
Okay, thank you. Yeah, I mean, so much of what you just presented was largely affected by all the federal spending during the COVID-19 pandemic. I'm wondering, well, I have two questions. One is sort of about both are about what you expect for the future. My particular interest is in the physician spending side. You know, are you expecting growth to tick back up then in 2023? And you know, what's going to happen as the pandemic spending from the federal government comes to a close?
So we'll probably have to take your second question because your first question is out in the future, and we don't have data for the future in front of us. We're just focused on the 2021 trends right now. So unfortunately, we don't have the data to provide you with an answer for that.
Yeah, I just do want to be clear. There are two separate releases each year, one looking backwards as this does with the most recent information. The other is projections, but they are separate. And so it is it's not possible to, we need to keep our questions focused on what we've learned about 2021. And Joyce, I didn't ask you to identify your outlet, but if
yes, I apologize. Joyce Frieden, MedPage Today. Yes. Well, can you talk about? Let me ask you this then. For 2021, do you have any specific detail on, for example, elements of physician spending? Which areas or which specialties increased particularly or declined?
Our analysis doesn't really go into that type of detail. We are able to break down Medicare and maybe Medicaid into further detail like that. We would have to get back to you on that specific question. We have more aggregate trends for total physician and clinical services, and our breakdown is really only between physicians and clinical services. So physician services, the growth rate was 5.1% in 2021, and that was down slightly from a 7% growth rate in 2020. We did see kind of the opposite happen for clinical expenditures. It accelerated in 2021, increasing 7% compared to growth of 5.4% in 2020. And
how do you define clinical? Does that include laboratory or the?
Yes, so we include spending for independently billing laboratories, and a lot of the physician clinical services is outpatient care facilities.
Okay, thank you. John, we'll go to you if you can identify yourself and go ahead and ask the question.
Hi, this is John Tazi from Bloomberg News. Thanks for doing the call. Just wondering if you have any breakdown of the drivers of spending in terms of price versus utilization. I think you mentioned this a little bit with respect to prescription drug prices declining and the growth being driven by utilization. But in terms of the other services, any breakdown you can give us there on the drivers of increased spending?
Okay, yeah, so for personal health care, prices were fairly stable in 2021. They increased 2.1% compared to 2% growth in 2020. Some of the services that had increased price growth, I think we had physician spending increased slightly with prices because of Medicare, which had a Medicare payment update. Hospital was fairly steady, and prescription drugs declined for the 4th year in a row.
Thank you. I think that captures the information. Rebecca, I see a hand up. Yes.
Hi, can you all hear me?
Yep.
Yes.
Great, awesome. Thanks for taking my question. So Rebecca Piper with Healthcare Dive. I'm just curious, is there any way to clarify how much of the medical goods and services utilization increase that bumped up spending was due to pent-up demand that was delayed during the pandemic?
So although we don't have a direct measure of utilization, we do have the total spending, and we do have our personal healthcare price index, which was fairly stable, which points to the indication that utilization increased in 2021. They clearly dropped in 2020 and then rebounded in 2021. And while there's not a consensus, it appears to be approaching the levels in 2019. We have other measures within the health accounts that we can kind of look at to back up these trends. And when we quoted one of them, when you have national health spending growth and take away the spending for the federal COVID supplemental funding, we show expenditures accelerating. And so that's generally due to the increase in use. If you look at one of our categories for just health insurance, we also show that accelerating. So a lot of the health insurance payers, such as private health insurance, Medicare, actually had payment or total spending accelerate in 2021. So the COVID spending at the national level actually does show this deceleration, whereas the underlying trends show an acceleration, which is due primarily to increased use.
Got it, thank you.
Great, thank you. I don't see more hands. I know sometimes it takes a little while for folks to digest this and craft a question, so I'll hold on for a moment. Sometimes I jump in with questions, but I actually think the explanations this year of what we do know were about as clear as I can imagine, so I don't have my own. And I do want to note, if you've not noticed in the chat, that you can request an interview or submit an inquiry directly to CMS. The information is in the chat. Any additional questions at this point? I'll just editorialize. Of course, I'm not speaking on behalf of anyone other than myself, that obviously the dominant story here is, as the team has suggested, the pulling back of the federal spending. But I think it is, and that affects the top line. I think the rebound of utilization is a critical part of the story, and it's of course the combination of these that lead to the overall results. But there's always been a question about when utilization will rebound, to what extent, to what degree, will it fully rebound? And there's lots of detail, but that is part of the story here. I see 2 new hands. So John, to you again, and then we'll go to Meryl.
Sure. Just curious, have you guys detected, or is there any data on sort of shifts in, site of service, or kind of, shifting patterns of utilization due to COVID, where, we've heard sort of some data reporting around, declining emergency room visits, and that some of that stuff might be sort of sticky past the pandemic. Just curious if any of that is evident in the data that you use for this report.
So we don't have data specific to that type of information, but when we do our analysis of certain segments, such as physician and clinical service, some of the detailed information that we look at has indicated that there's been an increase in telemedicine. But as far as some of the other indicators, I don't think we have our hands on that information right now.
Okay, Meryl, over to you. Meryl, I've got you still on mute. Looks like you're still on.
Oh, yeah. Can you hear me now?
Yes, thank you.
Okay, good. I'm sorry about that. I have to hit the mute button. This is sort of a technical question. On the net cost of health insurance, does that capture Medicaid and Medicare managed care, Medicare Advantage, or is that included in the Medicare and Medicaid spending numbers?
Both. So yeah, the net cost of insurance actually does include private health insurance, Medicare, and Medicaid because of the managed care portions. And then in Medicare and Medicaid, it is also reflected in our numbers.
Okay, well, that's what I had to ask. Thank you.
Sure.
Okay, any other questions? Oh, yes, Joyce, please.
Yes, thank you. Can you talk about what is included in the category of public health activity? Include like their laboratory spending, or public relations campaigns? What's in there?
Yeah, Hi, this is Aaron Catlin. Our category of public health has both federal and state and local public health spending in it. And it does include, as far as the COVID spending, it included some of the funding that was for vaccine development. It includes other public health efforts, just population-based healthcare that state and local and federal government pursue.
Thank you.
Okay, very good. I'll just close out unless, again, if someone sneaks in before I finish speaking. But thanks again to the CMS team for the work behind us, for the partnership with Health Affairs in releasing the information, and for the clear presentation of very complex information. To the reporters, we're under embargo until 4 p.m. Eastern. You can reach out to Health Affairs, or as you see in the link in the chat, to to CMS directly for additional inquiries. And since I managed to go on for a few more seconds and not see another hand go up, I'll say I think this was a really useful presentation and conversation. Happy to have you join us, and we'll let you go and hopefully see some stories at 4 p.m. Eastern after embargo is lifted. Thank you all.
Thank you.
Thank you.